Wow, things sure are getting crazy out there. Lots and lots of emotions, tempers, and illogical responses coming through, particularly around hydroxychloroquine here in the United States. Not so much confusion in other countries, which are just quietly using it, seemingly with great effect. Hello, everyone. Dr. Chris Martensen here with your daily update, calling this one Cutting Through the Noise, day 118 of our reporting here on May 20th. And this is your HB19, your honey badger 19 update. Why the honey badger virus? Because it can escape any enclosure, and it's pretty fearsome if it gets inside and decides to use its sharp claws on you. We've got some more data around that too, unfortunately. So, new milestone here. Coronavirus cases well over 5 million now. Those are noted cases across the world. Of course, I think the actual number is probably at least 10 times higher than that. I would think roughly 50 million people have been exposed to this thing and infected, many of them, of course, coming out of that asymptomatically with really not a lot to show for it. Other people can't seem to get rid of this thing. Hangs on for weeks and weeks, and other people, of course, very unfortunately, die from it. All right, before we go into everything, 5 million cases, nearly a third of a million deaths, closing in on 2 million recovered. That means there's still 3 million people out there with this thing, and some of them, as I mentioned, for many, many weeks. So, let's turn now to the email of the day coming to us from Jenna from Ontario. And thank you, everybody who's written in. It's very, very hard to pick one. And I love getting all of these messages. And thank you very much. It's the main compensation I get from this. It's the most important source, is hearing how this reporting has helped you evade the virus, evade the worst of it, evade the worst of lockdown, being adjusted emotionally, physically, mentally, all of those things. That's why I'm doing this, because I just love knowing that I'm able to help. All right. It says here, hello, I'm just writing to thank you for your daily broadcast and let you know you greatly helped my family stay safe. We've been listening to you since January, purchased 100 N95 masks, knowing we would have to give many to unprepared family and friends, and we found out 2 weeks ago that my mother-in-law has cancer and needs chemo. Very sorry to hear that, Jen. I hope everything goes well. That's sad. No one in the chemo room at the hospital is wearing a mask except her. Oh my gosh. So, yeah, it turns out that cancer is one of the great comorbidities in this story, and that's something that you would think everybody who is in the chemo room would absolutely want to be masked up, as well as probably wearing face shields if you're in a hospital setting, I would think, or some kind of eye protection. We are so grateful we have a surplus of those N95s, as she is obviously super vulnerable getting chemo and needing to step foot in the hospital frequently. Obviously, Jen is thinking this through very correctly at this point. So thank you. Everyone thought we were mask hoarders, but no, we were just prepared. Also, super frustrated with the hydroxychloroquine or HCQ drama. I'm wondering if it's possible for you to put together a video or just a file that we can share with our doctors of all the promising HCQ studies in the event we get COVID in the next couple months before HCQ becomes mainstream treatment. I'm in Canada, and our health minister advised doctors against prescribing it for COVID patients because of the heart problems the drug causes. I roll. Anyway, thank you again for helping my family during these weird, strange, crazy times. Jenna, you are most welcome, and thank you for listening and taking action. We're going to go into some of that hydroxychloroquine data. Actually, I think you've got a good point. It would be great to have this all assembled in a single spot. And I would have to go through, probably 10 presentations now and pull out the pieces. But let's go into one more piece that just came out today. Remember, there's two ways you can use hydroxychloroquine. One is post-exposure, and the other is what's called pre-exposure, and that would be PrEP, pre-exposure prophylaxis. It's got the R in it because PEP is post-exposure prophylaxis. So the little R gets a big R in PrEP acronym. So PrEP is pre-exposure prophylaxis. And check this out. This is pretty interesting. Came to us out of the Times of India here. The toll climbs to 9. Police have died in India here. And so these cops were on hydroxychloroquine sulfate. That's what the S is there. And those who were spared the worst. So this is from today. Very interesting. Let's read through this. More than half of the 10,000 policemen in the city of Mumbai who were to be given a prophylaxis drug meant to prevent COVID which has claimed 9 lives in the police force and affected 618 policemen in the city so far, refused to take it. All right, so there's a big interjecting clause in there. More than half of the 10,000 policemen in the city refused to take it. Around 10,000 policemen over the age of 40 years were to be given the drug hydroxychloroquine sulfate, HCQS, which was cleared by the ICMR as a drug with the potential to prevent a novel coronavirus infection. However, only 4,500 of the policemen are taking the medicine diligently, said Dr. Sanjay Kapote of Apollo Clinics, who arranged for the tablets and their distribution across the police stations. Continuing in this article, I got too much of that one in there. There has been concern over the growing mortality among the police force, even though many received HCQS and protective gear. The latest victims, a 50-year-old head constable attached to the anti-terrorism squad at Nagpada, who tested positive after his death on May 17th. He was diabetic and was down with typhoid. So a couple of bad comorbidities there, I guess. I don't know about typhoid, but diabetes for sure because of the cardiovascular bit. And remember you have those microthrombi that show up as a part of the coagulation disorder that COVID seems to trigger, and diabetics are more prone to that than other people without diabetes. This takes the toll of police personnel who have died in Mumbai in the last 25 days to 9. Meanwhile, on Tuesday, an assistant commissioner of police from the western suburbs tested positive for COVID-19 and has been hospitalized. And 3 officers over here attached to this police station have also tested positive. Here's the punchline. Dr. Capote said there was no mortality among the 4,500 policemen who took HCQS. Although some in this group have contracted COVID, they had a mild attack. So a James Tadaro, MD, over on Twitter gave us a nice summary of all that. 4,500 routinely took HCQ, 5,500 refused. Here are the results. In the HCQ group, 0 deaths. In the non-HCQ group, 9 deaths. And those who contracted COVID-19 in the HCQ group had mild attacks. So is this a clinical study? No. How certain can we be that the data has been collected correctly? Not at all. But I would love to see the data if they've actually collected it and when they can present it in something other than a news article. That would be awesome because I know that India was running several PrEP studies over there. Again, pre-exposure prophylaxis. So I'd love to see what they came up with that because, of course, what do we know about HCQ? It is something that you want to take before you actually catch the virus if you can. Just like with malaria, it's given before people travel to a region with malaria because you want to start taking it a week or even 2 weeks prior to showing up. So it's loaded in your system. It's changed all your lysosomal chemistry in your cells so that when the plasmodium try the spores of that try to get into your spores, the little plasmodium what do we call those little creatures? I don't know what their form would be. Is that it's not a larval form. It's at any rate, they're a little eukaryotic cell that comes and burrows into your blood cells and starts living, but it needs to use the cell's machinery in order to break down the hemoglobin, and hydroxychloroquine blocks that. All right, so it seems to also block the replication of the virus, COVID in this case, by some other mechanism, probably somewhat related to that. So at any rate, you want to take it early, you want to take it often. Here they used it on a pre-exposure prophylaxis way, and it seems to have worked. So we have some more data now to put in with that. Again, double-blinded, random, placebo-controlled. Nope. So we, take it for what it's worth. However, the Washington Post, in just 24 hours, thank you, Todd, who gave me this little collection. This isn't just 24 hours. This is yesterday on May 19th. They put out 6 articles. Here are the headlines. Trump says he's on a miracle COVID-19 drug. People who take his advice may die. Settle down, Karen. That's a little hyperbolic there. And a professor of science journalism at Stony Brook University. Oh, I'm not sure I would pay to take that course, Karen. Got to be honest. If Trump likes hydroxychloroquine, he'll love camel urine. All right, Dana. Hyperbolic. You're a columnist. You work at the Washington Post again, May 19th. Look at all these things. Here's another one. Doctors hate Trump's one weird hydroxychloroquine trick, obviously playing on the BuzzFeed, clickbaity thing. Fox's Neil Cavuto at center of Trump's hydroxychloroquine madness. It's madness. No emotionally leading language there. Trump is his own and his advisors' worst enemy, and this article focused on hydroxychloroquine as well. Trump's flimsy attack on vaccine official warning about hydroxychloroquine. So, wow, the Washington Post just went on an assault about hydroxychloroquine and Trump, because really what they were doing is I don't think they really care about the science in this case. Clearly, this had nothing to do with the science about this whole thing right here, I wouldn't think. Now, science wasn't part of that, this article. So it's much more of a political thing at this point in time. And so I got to tell you, if the shoe fits, what is the Cambridge Dictionary definition of fake news? It's false stories that appear to be news, spread on the internet or using other media, usually created to influence political views, or as a joke. I think this part doesn't really apply. I don't think these were meant to be a joke up here. But these are certainly meant to influence political views, and they're not based on the science, because the science is really stacking up that, this thing actually works. It's not a complete joke. It's not madness. It's not going to kill people. Sorry, Karen. That's not going to happen here. But Karen's got, she got some good support here about this whole idea that people might die, because the WHO put out a new warning just today here on May 20th. COVID-19, WHO warns of potential hydroxychloroquine side effects. Dr. Mike Ryan of the World Health Organization warned nations on Wednesday of the potential side effects of this dangerous drug, hydroxychloroquine. Adding, however, it's up to each country to weigh the evidence in support of the drug use. Sure thing. Here, you know what? I don't have to dig that far back into my own coverage here, because this from April 24th, this is pre-COVID WHO on chloroquine. And remember, their key conclusions here were, apart from halofantrine, the oral anti-malarial drugs, particularly chloroquine and piperacin, have been used extensively with very few reports of cardiotoxicity. Okay. Rapid parenteral administration of chloroquine, quinine, or quinidine may cause life-threatening hypotension, but there, you have to somehow put it into somebody's veins, or, give them a big, huge injection of it or something like that. But other than that, let's see their conclusions and recommendations from this big, giant report that the WHO put out, which was from March 2017. They answer their own question here. What is the frequency of sudden death attributable to the cardiotoxicity of different anti-malarial medicines? And it says here, despite hundreds of millions of doses, let me repeat that, hundreds of millions of doses administered in the treatment of malaria, there have been no reports of sudden unexplained death associated with even chloroquine, which isn't as safe as hydroxychloroquine. How many? No reports of sudden unexplained death. How many out of hundreds of millions of doses? No reports. All right. You know what? Honey Badger just don't care about all this bad reporting that's going on. All right. It's just terrible. It's terrible. People who take his advice may die. Look at that hyperbole. Well, let's go to the WHO, Karen, because you can do this yourself. This isn't hard, as particularly as a science reporter. What you would do is you would go over and you would Google, like I did, how dangerous is chloroquine or hydroxychloroquine? What's the data? And you'd find this huge, giant study from the WHO reporting no reports of sudden unexplained death. All right, moving on. China is maybe showing new strains. So you've probably seen this headline if you're following the news at all. I pulled this one from Japan Times. I saw 4 separate places I could have pulled this from, but it's all saying the same information here. China's new outbreak shows signs that coronavirus could be changing, code speak for mutating, of course. This is from that same article here in the Japan Times. Chinese doctors are seeing the coronavirus manifest differently among patients in its new cluster of cases in the northeast region compared to the original outbreak in Wuhan. suggesting that the pathogen may be changing in unknown ways and complicating efforts to stamp it out. I'm sorry to say, you can read this article and several other ones just like this, and there's no linkage between these new outcomes they think they're seeing and any genetic changes. So these haven't been sequenced yet, so we don't actually have... That would tie this up quite nicely, wouldn't it? Of course, if they could say, we've detected some mutations and here they are, I'm sure that work is ongoing. But we don't have anything. This is anecdotal at this point. So again, grain of salt for all of this particular reporting about this idea of a new strain. Patients found in the northern provinces of Jilin and Heilongjiang appear to carry the virus for a longer period of time and take longer to test negative. Qu Haibo, one of China's top critical care doctors, told state television on Tuesday patients in the Northeast also appear to be taking longer than the 1 to 2 weeks observed in Wuhan to develop symptoms after infection. So a longer incubation period, and this delayed onset is making it harder for authorities to catch cases before they spread, which is absolutely the case. That asymptomatic transfer period, I'm talking to you, Georgia, is a real thing, and it makes it really, really hard to stop this virus. The longer period during which infected patients show no symptoms has created clusters of family infections, said Q, who was earlier sent to Wuhan to help the original outbreak. Some 46 cases have been reported over the past 2 weeks, spread across 3 cities, Shulan, Jilin City, and Shenyang. In 2 provinces, a resurgence of infection that sparked renewed lockdown measures over a region of 100 million people for 46 cases. So you can see how seriously China's taken this. They had a bad run of it. They don't want to see this come back again. They're going to lock down 100 million people because they have 46 cases, but they have this troubling observation that there seems to be a longer incubation period and also a longer clearance period. It's likely that the observations in China don't have a simple correlation with a mutation. It's possible, yep. I can't wait to see the genetic data. Very clear evidence is needed before concluding the virus is mutating, this doctor said. Q said that doctors have also noticed patients in the Northeast cluster seem to have damage mostly in their lungs, whereas patients in Wuhan suffered multi-organ damage across heart, kidney, and gut. So, hey, that would be a good thing if it mutated in a way where it was really just creating the cytokine storm now, but less likely to directly attack these other tissues out there and organs. That would be fantastic. If that's the case, that would probably be pretty good news. But check this out. Officials now believe that the new cluster stemmed from contact with infected arrivals from Russia, which is one of the worst outbreaks in Europe. Genetic sequencing has showed a match between the Northeast cases and Russian-linked ones. All right, so they do have genetic sequencing, but they don't mention if they see any particular mutation that we can talk about here. Among the Northeast cluster, only 10% have turned critical, and 26 are hospitalized. Whoa, hold on. 46 cases over the past 2 weeks, 26 hospitalized. That means they have more than a 50% hospitalization rate and 10%. So that would be 4.6 of these individuals, roughly. 5, I guess there's something like that. 4 or 5 of these people have turned critical. That's actually that's not good because, I'm reasonably confident that what China is doing is very, very aggressive testing. So they probably have a complete sample size. And to see that we have 10% critical and more than half hospitalized is not a good sign. So I don't know what's going on here yet. We promise to keep tracking that, and we'll take more of a closer look at that in the future when we get the genetic data. In the meantime, this is troubling here. Well, maybe not that troubling, but it's certainly interesting. A Dutch farm worker contracted coronavirus from mink, according to the agriculture minister from yesterday, May 19th. A person who worked on a farm where mink are bred to export their fur contracted the coronavirus from the animals. Maybe some karma there. The Dutch agriculture minister said in a letter to Parliament on Wednesday, outbreaks on mink farms in the Netherlands were first reported in April, when keepers noticed some animals having difficulty breathing, prompting a wider investigation. In her letter, Carola Schouten acknowledged that earlier advisories from her office that people could infect animals, but not the other way around, was wrong. But she said the Netherlands Institute for Public Health still assesses as minimal the chance of transmission outside of the animal's stalls. Yeah, maybe. But for sure, we now, and by the way, chasing this article down fully, it turns out that they can confirm that the most likely thing that happened here was that a mink got it from a human and then gave it back to a human. So at any rate, that's a little bit troubling. So now let's talk about that idea of catching a disease from another animal. It's called zoonosis. And I think for obvious reasons, it's zoo. It has something to do with animals, right? Zoonosis is that process. So let's talk about this for a second, because it is really very, very rare, thankfully. Every animal species hosts unique viruses that have specifically adapted to infect it. Over time, some of these have jumped to humans. These are known as zoonotic viruses, and this comes from sciencefocus.com. As our populations grow, we move into wilder areas, which brings us into more frequent contact with animals we don't normally have contact with. Viruses can jump from animals to humans in the same way that they can pass between humans, through close contact with body fluids like mucus, blood, feces, or urine. Because every virus has evolved to target a particular species, it's rare for a virus to be able to jump to another species. It is rare for a virus to be able to jump to another species. When this does happen, it's by chance, and it usually requires a large amount of contact with the virus. Initially, the virus is usually not well suited to the new host and doesn't spread easily. Over time, however, it can evolve in the new host to produce variants that are better adapted. So a couple really important things in here. First, it's very rare for a virus to be able to jump to another species, but when it does, initially, that virus is usually not really all that well suited to the new host, doesn't really spread easily. And so this is something that was a little surprising to me about how SARS-CoV-2 came out, because you would think that if it had been, think of it like tuning into a radio station on an old analog radio. If some of you don't know what that means, sorry. But you come in close to the station, it's staticky, and you get into the station, right? And it goes back and forth, and you would expect that if SARS-CoV-2 had come out of, say, the bat caves in Hunan, that when you go and you look at the people around those caves, you would indeed find lots of serological evidence of this particular strain having been trying to come into their population for a while and doing it kind of unsuccessfully. So whatever happened with this virus, it not only jumped into humans, but did it really, really instantly and spectacularly well, and did it in a way such that it also was able to complete a few other jumps in here. So SARS-CoV-2 somehow jumped to humans, and then it jumped from humans to minks, and then from minks back to humans. So it seems to be really well suited, not just for humans, but jumping in minks. And of course, the mink data, not at all really surprising, because this is a mink. And you know what minks are close to? Ferrets. You can see the relationship there, right? These are both of the family Mustelidae, order Carnivora, I believe, and they're very closely related. So no surprise that you would see this jumping into minks. And why is it no surprise? Because we've known for a long time, let me go here first, that ferrets have been a lab model for SARS coronaviruses for many, many years. So I just did a constrained time search on Google to eliminate anything that happened since January 1st, 2020, and this is just what popped up when I looked for ferrets and COVID. Here's from 2008. The SARS-CoV ferret model in an infection challenge study. So here they're doing actual live animal studies in ferrets. The SARS-CoV ferret model, that's the same one, I believe. SARS virus infection of cats in ferrets. This is from 2003. Cats and ferrets can carry the SARS virus. We've known this since 2003 here. Well, SARS virus vaccine linked to liver damage in ferret study. So here they're trying to develop a SARS vaccine. So, of course, you put it back in ferrets. Anyway, the labs that have been exploring and looking at the SARS family of coronaviruses have been using ferrets as models all over the world, and also presumably in Wuhan at the Institute of Virology there. So here's a recent study. It just came out on April 8th. It says susceptibility of ferrets, cats, dogs, other domesticated animals to SARS-CoV-2. And here's the results. They say, we found that SARS-CoV-2 replicates poorly in dogs, pigs, chickens, and ducks. But ferrets and cats are permissive to infection. That means you give it to them, and they not only replicate it, but they can actually pass it on. We found experimentally that cats are susceptible to airborne infection. Okay, so if one cat sneezes, apparently another one can get it. Our study provides important insights into the animal models for SARS-CoV-2 and animal management for COVID-19 control. And why is this important? Well, because if we're really going to try and stamp this virus all the way out and we don't ever get one of those perfect vaccines, which, is a long shot, might not happen, then you have to worry about the animal reservoir. So if it turns out that minks and ferrets can harbor this virus and keep it among themselves, or cats can, or tigers, because we know now it can jump across many species in the cat family, then SARS-CoV-2 can actually live here, and it can become endemic in their populations as well, and that could be a problem for how we contain it and control it. All right, one last time, I got to ask, where did that polybasic PRRA furin cleavage site actually come from? This was a really nice list that I found over on Twitter, and that was from Dayu515. And note here, this is the insert site right here, this PRRA right there. And here you can see the sequence alignment for all these other SARS here that you got. Human SARS itself here, SARS, that's the original SARS classic. These are all variants of the original human SARS or classic coming from different places, Frankfurt, Urbani, in Civets. Here we got a raccoon dog SARS coronavirus. This is SARS-CoV-2 itself. You got the pangolin, the one that we talked about that has really close receptor binding domain sequence homology. You got the rat TG13 we've been talking about, that one right there. And all these other ones, all these bat SARS, right? Look at them all these bat SARS that have been studied. And you'll notice something pretty obvious about all of this. They all have exactly identical upstream sequences here around that polybasic furin cleavage site, perfectly identical all the way across all of these. And as well, out here in the S2 domain, all perfectly 100% preserved and identical across all of these. So you can tell these are really important preserved and conserved sequences, but for some reason, we have the PRRA right there, got inserted here into SARS-CoV-2, making it really stand out from everybody else. And so we got to ask, how did that get there? I've seen the paper where they found a really, really distant sort of a bat SARS where they say that it might have had an insert near that region. I'm going to quibble about that paper. I don't have time to go into all of that data right now, but how they lined that sequence up and said, oh, the deletions happened over here, but not. It's open for debate at this point in time. So I don't have enough data to go on that one. For now, I'm going to just show you how unlikely this is. These things are all perfectly, beautifully conserved. You make even single changes in certain regions, and it completely destroys the ability of the virus to be a virus. But somehow we got this whole giant insert in here. So that's still something I'm looking at. And again, I am completely agnostic about this. I stand ready to see data that would prove conclusively came from nature, or data to prove conclusively it came from a lab. I'm agnostic. I'm still waiting to see both of those. But I do find so far that the explanations for how this couldn't have come from a lab to be less than complete, and in some cases dissembling and not entirely honest. So that's what we got for today. And I'm just going to say hi, Ava, just in case you're listening. You got a great dad. And the conclusions for today are hydroxychloroquine seems to work for pre-exposure prophylaxis. That's what the India data is giving us. I want to see more of that data. I got to tell you, the Washington Post reporting on hydroxychloroquine, it fits the very definition of fake news at this point in time. It is fake news, right? Fake news, false stories that appear to be news, spread on the internet, or using other media, usually created to influence political views. That's what this is. This is all very political at this point in time. So we're just going to continue to point out what the data actually is, because I like the data. I'll let the data do the speaking, and I don't actually care left, right, how anything is falling out. I care about up, down. All right. Multiple zoonotic jumps by SARS-CoV-2. It seems odd to me. It just seems odd that a virus didn't really muck about and have these false starts trying to get into humans, but it just suddenly jumped into humans and then has been able to jump to many species since then. It's all of a sudden, zoonotic jumps are supposed to be really hard. All of a sudden, apparently they're pretty easy. So that's something that I find odd in this particular case. Again, it's not completely impossible, but it's just odd. And I'm going to keep exploring that. Remember, if you want to understand the economic impacts, particularly around what the Federal Reserve is doing, watch this. You go to peakprosperity.com/WTF2, which is what the Fed 2. Why 2? Because we've done it once before. Both of those are really good, and you should watch those if you want. Remember as well, you can also download a free copy of the book that Adam Taggart and I co-wrote called Prosper. And that takes you through 8 forms of capital. And you know what one of my favorite forms of capital is? Living capital. What's living capital? Hey, that's a garden you might plant. It's the abundance of the ecosystem around your house and home and in the ecosystem you live. It's also the fitness and health of your body. That's your living capital that is most important to you. So with all of that, I am taking tomorrow off. I will be back with you on Friday, and that would be Friday the 22nd. So we'll be back, and I want you to have a great night and a great couple of days. We'll see you then. Thanks for listening. Remember, hit like, hit subscribe, but only if you actually liked it and you want to help other people find messages like these that I put a lot of time and effort into. And so that would be something you could do for me. All right. Thanks a lot. We'll talk soon. Bye-bye.
WTF, What the Fed, Round 2. Last time we were together, we were very concerned because the Fed had added $200 billion to its balance sheet. Little did we know, a few weeks after we chatted, the coronavirus exploded across the world, and in response, the Fed and the world's central banks have now been printing trillions and trillions of dollars, making the magnitude that we were concerned about look positively quaint.
Isn't it optically awful that Bernanke, the past chairman, went to join Citadel, which was one of the first entities to receive a bailout? What hasn't changed would be an easier question, because so much has changed at this point in time.
1 in 5 of the workforce in America has lost their job in the last 6 weeks, and the market has gone up. We've had unemployment jump to 14.7% from 3.5%, and the market has gone up. We've seen consumer credit and consumer spending collapse to all-time lows, and the market has gone up.
Every emergency effort to save the system makes it more fragile.
The data is suggesting that there isn't any way out of this except to print the dollar into oblivion.
They're picking the 0.1% and the 1% over everybody else again.
This deflation will continue for a while, but then there's going to come a day where all of the currency printing comes back with a vengeance. We are now witnessing the death of this currency system.